What does patient care mean?
I love this question. Patient care is a term that's used a lot in healthcare, that we optimize patient care, we prioritize patient care. Patient care is number one. That's true. Nothing wrong with those statements. They're sort of trite. But what does it mean, patient care? So when people think of the term, you often think of the patient in a chair or in the bed, and the healthcare provider with a white coat right next to the bed, maybe holding the patient's hand and empathizing. So this is the vision one gets with patient care. And certainly that's patient care. It's immediately next to the patient, next to the bedside, speaking to the patient or providing a service or procedure. Definitely patient care. So patient care is here, right? Let's look at the context of PAD, what we specialize in. PAD, evaluation and procedures. The patient care is right when we're seeing the patient at the evaluation, right? Our evaluation team, our skilled nurse practitioner, our medical assistant, and our ultrasound tech, that's definitely patient care. And then later when the patient comes in and has their procedure done, our proceduralist and the entire procedure team, that's definitely patient care. So is that all the patient care we do? I pose that the answer is no. You see, to get to these points, there's a lot of things that have to happen both before and after. On the front end, we have educators and business development associates and community liaisons out in the communities that we have a presence. And they're educating the community. They're educating referring physicians, offices, their staffs on what PAD is, what to look for, what the signs and symptoms are, what the indications for referral are. They're doing screening events. They're doing a lot of work up here. And this is the first step to lead downstream to patient care. So I pose it that this is also patient care. It's all connected, right? There's so many steps that go along with what we do. We have our business development associates out there educating the community, educating providers, raising awareness for PAD. After that, we have our patient care coordinators, front office, scheduling patients, speaking to them on the phone, answering their questions. Our insurance verifiers, verifying the insurance, making sure the paperwork's done, the I's are dotted, T's are crossed. Then we have the consult team, more sort of visible patient care, evaluation. Then they'll come back. And in between that, they'll have more calls with our patient care coordinators to come in for the next appointment. Then we'll have more visible patient care again in the form of the procedure. Then after that, they'll have follow-up appointments. We'll communicate with their insurance to make sure the bills are paid, right? So this process, anywhere along here, if the process fails, this patient care, visible patient care, won't happen. So my thesis is, my position is, it's all patient care. If our business development associates don't do their job optimally to educate the community, patients won't be identified and they'll never get down here. So that's patient care, and that compromises patient care if we don't do our job right. Same thing with the patient care coordinators, the insurance verifiers. You don't think of that as patient care, but it all ties in. If they don't do their job optimally, we won't get the patient to get to this process and get to this point in the process and get the care that they need. So that's patient care. Of course, the visible parts of patient care, the evaluation, the procedure, those are obviously visible patient care. The traditional type of patient care that most people think about. The back end, the running the business, the management team, who's making sure, which I'm a part of, who makes sure the trains are on time, the operations, the processes, the finances are healthy and strong. This is all patient care. Because if any of these fail or are weak, this visible patient care won't happen. So absolutely, we prioritize patient care number one, but it's more than a platitude with us. It's something we live, eat, and breathe and practice every single day. And it's everything we do in the organization. To get to this visible patient care, a lot of things have to be done upstream from that. A lot of I's have to be dotted, a lot of T's have to be crossed. This is why we're a detailed-oriented business. Processes, procedures, protocols, training, paperwork. Everything has to be precise and perfect, because this one thing leads to another, and it's all patient care, which is something we absolutely prioritize above all else.